Hi guys. Today my group is doing a teaching and learning presentation on teaching young parents on accident prevention for preschool age. It's done by myself, Taisha, my colleague Diane, and Grace. Now I'll pass you over to Grace to get into it.
Why should we need to do this? Let's look at your reality. According to a Canadian Pediatric Society in 2024, young parents and their children may be at high risk for negative health outcomes, and accidents are a leading cause of injury and death in young children. As we know, preschoolers' characters are full of curiosity, activeness, and have limited danger awareness. They need constant supervision and safe surroundings. Prevention saves lives, lower health care costs, and promotes parental confidence and responsibility. Let's imagine a scenario. Sarah and Debbie are both 17-year-olds who are born in Canada and have a 3-year-old boy, Chris. The family lives in a one-bedroom apartment. To support the family, Debbie dropped school and recently worked as a merchandiser in a retail store. Sarah, who also dropped her school since her pregnancy and take care of Chris at home. Chris recently had a fracture on his arm, and the nurse is having checking by a family visiting. The nurse decided to have a teaching and learning session to help the family prevent future risk of accident injury. In Canada, young parents are from age of 12-year-old to early 20s. They are in the physical, cognitive, psychosocial development phase. Before teaching, nurse should assess Sarah and David's culture and spiritual beliefs, their knowledge and experience, their motivations and learning preference.
Hi, my name is Diane. The assessment helped us understand our clients and provide cultural safety care to meet their needs. Both parents have no religion and be able to read and speak English. David is the only one who is working to provide financial support to the family. We have noticed some improvements needed to be done for safer home environment during the assessment. No parents had found using substances or involved in abusive relationship. They have motivation to learn because Sarah feels guilty about Chris's injury. They want to prevent it from happening again. Parents also find struggle about how to make improvements because these parents are at younger age. So they would like to have options while they're learning. We have to make sure during the teaching session to provide them various learning materials and encourage them to express their thoughts. Also, it's important for us to provide non-judgmental conversation. Teaching goal. At the end of teaching session, we hope parents will be able to identify 3 home and outdoor hazards related to falls. They could be able to understand development stage of their child. Parents will demonstrate 3 preventive actions, such as using safety gate. Parents will demonstrate their awareness about other 3 accident risks related to preschool age children. Parents will show their confidence and motivation in create a safer living environment. Our teaching will mainly focus on cause factors related to falls, such as the risks on environment setting, an open window, and ungated stairs. Falls may happen when child plays alone, when they are climbing on furniture or trying to reach something at higher level. We're also going to mention other common accidents such as burning, choking, and poisoning, the risk factors, and the prevention strategies. We're going to include some theories such as Erickson's initiative versus guilt and Piaget's pre-operational stage to help our parents understand their preschool age children's developmental stage, because children at this age group don't really understand the cause and effect. They cannot predict the consequences of risk behaviors when they were exploring the environment and trying to learn may cause them to get injured. By understanding these theories, parents will be able to understand child are curious and eager to explore at this age. They can be able to change their parental style, attitudes, and behaviors to provide safer living environment and safe supervision to their child and help to decrease injury occur at home and outdoors. To achieve a positive learning outcome, we will prepare a quiet room with comfortable seating area and age-appropriate toys for Chris. Our teaching strategy will involve all learning domains, such as ask open-ended questions to engage parents to think and help them to reflect on what they could do better to prevent accident happening at home. Parents will be engaged to discuss accident and injury topics and to share their experience on environment preparation and injury prevention strategies. To evaluate the learning outcome, we will encourage parents to teach back by using role play, and we're going to prepare materials and resources such as videos, charts, pictures for parents to identify what are safe and unsafe environment.
Hi, David. Since Chris just turned 4, let's discuss keeping him safe at home and at school. At this age, kids are full of curiosity and energy, which is wonderful, but it also means more chances for accidents. Let's go over some simple accident prevention tips.
Oh, yes, he's always running and jumping around. We are trying to keep up.
That's very common for a 4-year-old. At that age, his developmental characteristics include exploring and testing limits, but keep dangerous items like cleaning supplies, medication, and sharp objects out of reach. Store them in higher cupboards or with childproof locks so Chris don't get to them and mistake them for juice or candy.
We do keep cleaning supplies under the skin.
We'll move them when we get home.
He's brave sometimes. He tries to climb the counter to reach things, and we fear that one day he will fall.
Okay. Make sure Chris can climb up furniture, especially near windows. Make sure you have window locks. Keep him safe away from window lids. Also, you could use soft rugs and no loose cords or wires. For outdoor safety, if he's riding his bike, make sure he's always wearing his helmet.
We have a helmet, but he doesn't always want to wear it.
That's normal. Encourage him with words like, all big kids wear their helmets, all superheroes wear helmets. Kids love to copy role models. Okay, let's comb through the details. Could you tell me what should you do if you go out to play or simply playing in your environment?
I always keep my eye on Chris when he's playing and remind him that things like outlets are grown-up only things.
He likes space time when he's ducky, so I always supervise him.
Very good. You can also prevent burning accidents by turning pot handles on the stove inwards. Always keeping an eye on him is great, especially in small tubs and backyard pools. These too can be dangerous. Even enrolling him in swimming lessons, if possible, is great for development and safety.
We're trying to be very courteous.
We have taught him not to run into the street and to hold an adult's hand in public.
Good, yes, that is very important. As first-time parents, I'm very proud of you guys. Teach him the phrase stop, look, and hold hands.
That's a good one. We will practice that when we walk to daycare. I feel much better having more knowledge about his developmental stage and safety.
Yes, now I feel like we are better equipped to keep him safe.
You're already doing a great job, and these tips just help keep him growing safe. Could you tell me 3 preventative factors you learned today, including medication prevention, safety?
Now I know I should use protection on sharp corners, put away sharp objects, keep his play area clear, use a soft rug on the floor, and ensure he wears his helmet every time he rides his bike.
I'm comfortable now that I know preventing these injuries, including keeping a safer, closer eye on Chris and maybe mounting the TV on the wall, will stop him from climbing up to it. And also, I'm going to use log to store medication safely to prevent him reaching out of these.
Wonderful. This shows that you guys understand what we discussed today. I have a handout here for you guys. It's easy to stick on the fridge and it has home safety and prevention checklists. Prevention is all about teamwork between nurses and parents. You're helping Chris stay safe and build smart habits early.
Oh, thank you.
That handout would be great. Thank you.
Wonderful. Our teaching and learning presentation was instrumental in equipping our young parents with extensive knowledge regarding critical home and outdoor hazards. A key indicator of success was the client's subsequent ability to actively integrate learned preventative strategies into their everyday routine. By applying teaching methodologies precisely tailored to the developmental needs of young parents, the intervention successfully cultivated visible signs of confidence, engagement, eagerness, and motivation towards establishing a safe environment for their child. In all working together, we're able to come out successful. Hope you enjoyed.